All right. Good evening. Here is the rationale for your FHC first part. Arterial pressure, heart relaxation, that is your diastolic, isn't it? That's letter A. Which of the following increases your against infection? Okay, lactalbumin. Tandaan ang lactalbumin that is on your breastfed milk, breast milk. Makukuha ang lactalbumin, that's a protein. While sa formula fed kahapon, ang sabi ko, that is your casein. Your casein. Like that. So, basta formula siya na milk, that is casein, while lactalbumin is in a breast milk. Now, this is your leukocytes or WBC. So, the answer is letter C. Alright? So, the answer is letter C. Next is number 3. What is the site for popliteal? That is posterior to the ankle. That is your posterior tibialis. Lateral to the eye, that is your temporal. And the answer is none of the above. Letter C again. What is responsible for fluid electrolyte balance? That is your genitourinary. Letter C. Okay, the kidney is responsible to filter the blood. And once it is being filtered, it's not yet a urine, but it's called a filtrate. So the filtrate will go to the part of your collecting duct. Once it's arrived there in the collecting duct, doon na siya magiging urine. It will be passed through the ureter, then stored to your bladder. Then passed through the urethra. Okay? The answer is letter C. Which of the following is not sign of infected wound? For number 5, which of the following is sign of, obstruction of the air passage is not related? Letter C. The following are the obstetrical complications that cause mortality except that cause mortality of a mother, that is your metabolic disease. Letter C. The following are the laboratory examinations that are routinely ordered for the pregnant for the first visit. What would be the answer? Okay, it's 1, 2, 3, 4. Very good. Oh, hold on. Hold on, guys. Hold on a minute. So, the question goes with just a minute. Just a minute longer. That is number what? Number 6 question. So, complete blood count, that is correct. Urinalysis, that is correct, to determine if there's a HCG presence. That is correct. Blood typing, para malaman natin kung RH negative or RH positive ang mother. I don't think so, the pap smear. Okay? But I would like to clarify that one. Hold on. Let me clarify first. Complete blood count, urinalysis, blood typing. Okay. Hold on. Yes, exactly. That's the point. That the pap smear is not typically performed during the first prenatal visit if the pregnant woman has a recent normal pap smear result. If the pregnant woman has a recent pap smear result within the past year. So, has never had a pap smear. However, pwede. Okay, so 1, 2, 3, 4 is the answer. So that is letter A. Okay, that's A. If the blood pressure is 130/85, what is the pulse pressure? You have to deduct systolic minus diastolic, subtract it that 1, And that could cause your 45 if not mistaken. Right? If not mistaken, Sandra. Tama ba? 45. Yeah, 45. Now, the type of immunity provided by a mother, the type of immunity provided by a mother injected with tetanus toxoid is that is a vaccine. The type of immunity provided by the mother, okay, injected with tetanus toxoid during pregnancy to her baby is, kasi to her baby na eh. So, that is your, yeah, exactly. Kasi, to her baby kasi ang tanong. Kasi kung para kay mommy, that is active, artificial. Yes, exactly. So that is passive, natural. Like your breastfeeding. So letter C. Number 10, inspecting the genitalia of the pregnant mother. The midwife a speculum to view the cervix. She must position in her perfect lithotomy. Letter A. Okay naman ang dorsal recumbent. Pero speculum ang gagamitin. The more it is wider, the more it is better. It gives an easy access to the genital area during the speculum examination. 11. Kung kanina relaxation, yan naman ay contraction, and that is your systolic. Letter B. That is the filling out of the blood, no, going to your aorta, and systemic circulation will happen. One of the pregnant mother in the clinic has fainted. What is the thing you must have to check? Anong check? Very good. Airway. Letter D. The best position that the fainted mother must be placed is correct. Must be placed on what? Sitting position. Sitting could be the best, but yes, exactly. Hold on. Let me clarify para tama ang ating ano. So the best position for a fainted pregnant mother is to place the pregnant mother in the recovery position, turn her onto her left side straight, and position her left straight and her right leg bent. Tilt her head back slightly and tilt her chin. Oh yes, there is a confusion on it. Malalaman natin. Placing the mother on her back, elevating her hips and legs above her head. Okay, that is Trendelenburg position. Okay, Trendelenburg, that's correct. Letter A. One of the mother has blood pressure, 140/90, ankle edema, laboratory test. Okay. And the best answer for this is suspected for a preeclampsia. Correct? So since there is a suspect for preeclampsia, all you need to do is to check for that laboratory called acetic acid test. Correct? Number 14? Alright, number 14 is correct. Laboratory test for urine must be ordered for his mother. Very good. Now, the problem here is, okay, ang tinatanong kasi is laboratory test. No? Laboratory test. So, if this is a laboratory test, I believe that the other one is just being done in the health center. But the most reliable is the other one. Right? So, for further and for the verification, we need to make sure we are correct with this one. Okay? So, anong sabi niya? Alright, very good. At least now, here is the rationale. The best answer for this one is letter B, because your acetic acid test is not a laboratory test. Okay? What is the possible problem? This mother in number 15. Yeah, preeclampsia, PIH, letter A. Very good. Nice one. I love it. Now let's proceed. An 8-month pregnant mother complained of leg cramps. Okay, straighten the leg and dorsiflex the feet. When you say dorsiflex, ganito dapat ang paa niya gumanon. Ayan. Okay, so that the answer is letter A. What number? 17. For number 17, oh, that is the leaves of the guava for washing the wound. Letter C. Number 18, the most important heat regulating cell. Oh my God, it's hypothalamus. The most common newborn death is birth asphyxia. The responsibility of the midwife in the labor room in the lying-in clinic is, okay, the question is in the labor room. Of course, others can be on the DR table already, or DR area. So, only for the labor room activity is letter A. Fundic height was measured palpation, letter B. Okay? Number 22. What is done by the midwife to check position, life present? That is Lupol's maneuver, letter C. What method examination was used when the midwife did a Lupol's maneuver? Palpation, letter B. You don't do percussion. The presence of pus in the urine called pyuria. Okay? Usually, pag may mga UTI. Remember, the E. coli is the causative agent for that. And that's common for women. If the pulse in the left, this is no answer, bonus. Cold application is often used to treat EXAP. EXAP 26, open wound. Okay, now another complaint. Open wound. Okay, we'll have to make sure. Okay, based on what the source said, all right. Yes. For your cold temperature, it helps to reduce bleeding, decrease the swelling, ease the pain, and prevent infection. It is being done, tanda na, 15 to 20 minutes lang yan siya. Or, shall we say, 3 to 4 times a day. So, we need to avoid the hot application. That is correct. Okay? So, open wound is for cold application, not for hot application. So, the question is, EXAP. Right? Exempt siya. So, ang burn mo, gina-cold application, na, not a fever, I don't think so. It's a lukewarm. Yes. Lukewarm ang fever, hindi cold. So, we'll see what the source will say. Okay. There you go. Alright. Very technical sila, guys. So, ang answer nila dito, it's what? Letter B. Right? Letter B. Why letter B? Yeah. Correct. Why letter B? Because burn should be treated with cool application, not cold application. Kasi if it is cold, it will really vasoconstrict the blood vessels of the patient, decreases the blood supply to the area, magkakaroon ng necrosis ang tissues. So, hindi po pwede. Very good. The best answer is supposed to be is letter B. What aseptic technique midwife delivery for the baby Cortez will use? Of course, that is sterile technique. Okay? Yeah, it's sterile technique. Am I right? It's sterile technique. What number? 27. Oh, it's not a question anymore. 28. So number 28, contract the uterus. That is the purpose of your Methergine. But remember, on your Methergine, you need to check the BP of the patient, because if the BP is high, avoid giving Methergine. Instead, give oxytocin. Right? Ulitin natin. If the BP is high, do not give Methergine. Instead, give your oxytocin. Mostly, Methergine is being given if the patient is already having what? Shock. Average loss of vaginal delivery. Okay? Average loss of vaginal delivery. Now, so the average loss of vaginal delivery is, based on our source, what is the answer? It's 500 ml. However, ayun na. Yes, very good. Okay. All right. Okay, I'll explain why. Okay. So if we are talking about the average, if it is 1-3, oh yeah, because there was an option like there is a 600 ml on this question before. I already have this kind of question. They have this 600 ml as the other option. Yeah, there is 600 ml as the other option. So now I understand why it is 600 ml, not 300 ml as the answer. Why? Because some of women have the blood loss normally 300 to 1,000, and others has 400 to 600. That's why if you're gonna have to add 400 to 600, it's 1,000 divided by 2. That makes the average of 500 ml. Since on that options before, there's no 500 ml, a confusion happened, either 300 to 600. Now, but the other source tells us that this 300 to 100, if you're gonna have to add this one, it's 1,300 divided by 2, almost 650, something like that. So, we need to make sure, ulitin ko ha, the answer here is not 300, but it's 600 ml. Kasi average blood loss ang tinatanong. There is a normal blood loss of 300 to 1,000. There is a normal blood loss of 400 to 600. That makes 500 as the average blood loss. Since the option has no 500, the original on this question has a 600 ml. I know, there's a 600 on it. But I prefer to answer before 300. Now, I understand why it is 600. So, the correct answer is letter no answer. No correct answer in this question, but the answer is 600 ml dapat. Right? Let's proceed to the next one. At least things has been clarified. Which of the following is the bad effects of iodine deficiency? It's letter B, growth retardation. A HELOT, pregnant termination, the use of catheter will most likely lead to. Alright, bladder infect. Oh. Yeah. Oh, for pregnant termination. Okay? Pregnant termination, if we're gonna have to use catheter, and use catheter, okay, will lead to uterine perforation. Very good. That's it. A uterine infection. So I don't know if it's the same with Sandra. Okay, the correct answer is letter? Yeah, A. Which is an objective sign. When you say objective, nakita ni midwife, that is your puffy eyes, boy. If your patient is in profound unconsciousness, she is. What do you mean by profound? Okay. Anong ibig sabihin ng profound unconsciousness? Yes, either lethargy or, yeah. Alright. When you do have a profound unconsciousness, the patient would be unresponsive, no response. So this could be, hold on. Profound consciousness means lethargic or stupor or comatose. It is comatose, if for sure. Yes. Yes, very good. When you say kasi lethargic, drowsy lang. When you say stupor, it's stupor na talaga. So pag mababa na siya sa lethargic. So it's stupor that will lead to become comatose. No? Poor na ang chances to become conscious again. So very, very clear. It's letter A. What method is used to doctor with sense of hearing? Oh, of course, auscultation. What else? Okay, kwashiorkor is characterized by protein deficiency. If I'm not mistaken, it's protein deficiency. No? Kwashiorkor. Okay? Yes. Kasi ang kwashiorkor is a deficiency of protein, right? Yes, correct. So, ano makikita mo doon sa kay patient na may kwashiorkor? First, may swelling, may muscle wasting, may poor growth and retardation, and increased risk of infection. Okay? On the other hand, iba rin yun si deficiency in calorie is called marasmus, correct? Okay. Ano namang hanapin natin doon sa kay marasmus? Yes, the old man's face, and then, yeah, that's it. Almost the same. But, si protein is my, si marasmus ang may old man's face. Old man's face, marasmus or kwashiorkor? Answer? Okay, the answer is marasmus. So I'm right. So that's marasmus. Let's go now to your caloric rate of a child best determined by a cardiac rate of a child best determined by. Hold on. If we are going to check the cardiac rate, we will always need to use what? Stethoscope. Cardiac rate of a child is best determined by Answer? Very good. So to the apical pulse, so we need to auscultate. No? Auscultate. Letter B. So remember ba sa child, anong sabi ko sa child? Saan makikita ang kanyang PMI? It's on the fourth ICS, midclavicular, or on the nipple. So number 37, implementing step of the midwife. The process is the step where the midwife will do the action, of course. Letter C, implementation. Regular pap smear for women. Regular pap smear for women. Yeah, that is to detect diagnosis. Letter B. Regular pap smear for women. Primary or secondary prevention? That is secondary prevention. Always. Kasi that is to early detection. In case of postpartum bleeding, recommended position is Trendelenburg. Which of the following is diuretic effect? Sambong. RB cells are cells called erythrocytes. Which is the route administration for polio vaccine? Oh, of course. Depende. Pag sabin, it's sa bibig. Oral. Pero pag salt, it's IM. Okay? So since oral polio vaccine sinabi niya, commonly route, it's oral. And the answer is letter D. Okay, ang IM na yan is for the salt vaccine. Okay, Mother Anna is having the prenatal check-up. The most insight in taking the pulse accurately is radial. What else? She's a mother then. Which of the following herbal plant traditional toothache? Oh my God. Okay. Guava, of course, for pain. Which is the route administration for DPT to infants? IM. Dog. Auscultation is done by the physician with the aid of flashlight. Lol. It's A. Stethoscope. Rectal examination. Which position be assumed by the patient? Knee, chest. Letter C. Which position to be assumed during the throat examination? Sitting or Fowler's? A sit-up. Right? Throat examination. Always remember how it is being done. The examiner is at the back. Throat examination is being done Fowler's or sit-up. Fowler's or sitting. What would be answers? Alright. It's being done Fowler's or sitting. Yeah. Sitting position, sit up. Letter D, dog. Which blood vessels carries blood toward the heart? Toward the heart, artery. Which blood vessels carries blood? Towards the heart. It's the vein. Right? Which blood vessel carries blood toward the heart? What blood are you referring? Is it oxygenated? What blood vessels carries blood toward the heart? Is it the vein or the artery? The vein, exactly. That is what you're referring with. That is letter B. In giving BCG, okay? In giving BCG to infant, which is the proper site of administration? Alright, what is the proper site for administration? Left upper arm deltoid. Is that left upper arm deltoid? Okay, left deltoid arm. Letter D. But, hold on. Yes, it is in the left upper arm, deltoid. What is the difference of this outer part of the outer arm? BCG administration, is it outer part of outer arm or left deltoid arm? We'll see. Okay. Outer part of the upper left. Yeah, kasi pwede ka na naman kasi magsagot ng deltoid, left deltoid arm, but it's not specific to which area. The more specific here is the outer part of the outer arm. What is outer part of the outer arm? It might be outer part of the upper arm, no? Outer part of the upper arm. So most probably that is outer part of outer arm. That's very wrong. Outer part of outer arm. Ano ba yun? Okay. So still, I'll stick with letter D. Left deltoid arm. Although there is no specific area that it is outer or inner, but the direction of the left. Okay? Yeah. Actually, it is not really the deltoid. Yes. Hindi talaga siya yung deltoid kasi 'di ba intradermal naman 'yan. It should be outer aspect of the upper arm, just above the elbow. Outer aspect of the upper arm. It should be upper, not outer arm. So left deltoid arm. Okay, letter D. I'll stick with letter D. Okay, that would be all for today.